We have 25 new cases who tested positive in British Columbia, bringing our total to 2,112. That includes 815 people in the Vancouver Coastal Health Region, 961 people in the Fraser Health Region, 120 people on Vancouver Island Health Region, 170 people in the Interior Health Region, and 46 people in the Northern Health Region. We continue to have 24 active outbreaks in long-term care, assisted living, and 3 acute care units. We have no new long-term care facility outbreaks. We have a number of new cases, however, in long-term care, bringing our total to 256 residents and 153 staff who have been affected. And as we know, 12 of these outbreaks have been declared over. We have ongoing investigations in a number of community outbreaks, including 50 cases still at Superior Poultry and 42 at United Poultry, and that remains the same, although ongoing investigation and testing is happening. We have 120 cases now at the Mission Medium Security Correctional Facility, Federal Correctional Facility, so that's an additional 12 inmates who have been tested positive at that facility. And again, the investigation and the monitoring of everybody in that facility is ongoing. We know that there are many people who have already been exposed, and so we expect there may be more people who develop symptoms over the coming days and weeks. Of our cases today, 82 people are in hospital, and of those, 30 are now in critical care or ICU. We've had an additional 2 deaths related to COVID-19 here in BC, including one senior in our long-term care home and one person who died in hospital in Vancouver Coastal Health Region. We now have 1,322 people who have fully recovered from COVID-19. Today is another one of those landmark days in that it's been 100 days since we put out our first warning and statement around what we were calling then the novel coronavirus, our first provincial statement. We did it because we were concerned about what this detection in China at the time might mean for all of us, and how this virus that we needed to pay attention to, that we needed to start thinking about preparing for the possibility that was coming here to British Columbia. We want you to know that the risks of what now we know is COVID-19, what they could be, and what they could be in China and with travel initially, and then as it spread around the world. We wanted to know that we remain committed to making sure that we do continue to provide the information that everybody in BC needs to continue to stay safe. In the last 100 days, we have all watched as the pandemic spread, first in China and then around the world, and affected us here in British Columbia and across Canada. Our lives, our businesses, our communities have dramatically changed in this last 100 days. And yet one thing really has stayed the same, and that is the unwavering commitment of everybody here in British Columbia to work together and to keep our firewall strong, to do everything we can to protect our communities, our seniors and elders in particular, and our families across British Columbia. In the coming days, we're going to be sharing updates about our modeling. I'm going to be sharing more of the epidemiologic information about who's been affected and where. And this modeling in particular continues to inform our thinking based on what we are seeing here in British Columbia, our pandemic, and it's what will help us move into this next phase. And the Premier will be speaking next week, as we've indicated, on our go-forward plan. And our goal is to continue to give you all of the information you need to keep safe as we move ahead. Right now, we need to stay strong and continue to bend our curve down. We all need to be champions of safe physical distancing, of hand washing, of staying connected at a distance to those who are at high risk and who may be alone, and those in our community. We need to support those around us to self-isolate when they are ill, to make sure that all of us take responsibility for ourselves and for our children to stay away from others if we are sick. We need to continue to be caring and compassionate to our friends, our neighbors, our community, and to show the appreciation for the countless British Columbians who are protecting us, whether they're healthcare workers, whether they're grocery workers, whether they're ensuring that we have food on our table. And we need to continue to do all of this by being kind and being calm and staying safe.